Obviously, there's no one-size-fits-all approach to this, but when you look at risk and how to stratify risk of having an event like a wedding, it really is going to come down to 6 variables: time, place, people, space, masks, and vaccination. So when you talk about time, obviously a wedding is an event that goes considerably more than 15 minutes. That's a risk factor. So how to mitigate that risk factor of such a long period of time exposure is going to be important. Whether it's indoors or outdoors, outdoors will be much, much safer in terms of airflow and ventilation. Space in between people, that's something that really can be controlled. So that's some good news. Masking, again, now we have over about a year of data that shows that when people wear masks, it not only protects those around the person wearing the mask, but offers some degree of protection to the person wearing the mask. If there are people who are older, people who have chronic medical conditions, people who are at high risk for complications of COVID-19, I think it's a selfless and responsible thing to do, even for a person who's been vaccinated, to continue wearing a mask. As tests are more available, more widespread, even a rapid antigen test a day before the wedding can give an added layer of security for someone to know that they were just tested and in fact they were negative. And then how many people have been vaccinated at an event as long as it's 2 weeks or more after their final dose. Right now, in terms of the vaccines, the data from the clinical trials and emerging data from real-world experience seems to be really outperforming what scientists expected from these COVID vaccines. In other words, they are highly effective in reducing the chances of hospitalizations and deaths. There is emerging data that they are highly effective in preventing asymptomatic infection as well. There's a time period that someone needs to literally wait after their full dose of the vaccine, either a single dose or their second dose, until they have what's considered to be full immune protection. They do not say or claim to be 100% effective in preventing someone from becoming infected with COVID-19. So for all of those reasons, it is really, really important that when people are vaccinated 2 weeks after their final dose, that they proceed with caution. The general belief is that as more of the U.S. population is vaccinated and the overall rates of COVID-19, the case numbers over a 7-day period of time start to go down, that we will see updated guidelines and recommendations based on, science and real data in terms of what we can do and not do. And at the end of the day, I think it's really important to go with the science, err on the side of caution, and understand that in public health and medicine and science, we have to distinguish between what we want to do and what we should do.